Good morning, Illini. Welcome back to Healthy Illini Podcast. I'm your host, Matt Schrock, and welcome to 2025. This is our first episode of the new year, so we're glad you're here with us. We're getting ready to crank into the semester here at the U of I. But before we do that, we wanted to drop an episode kind of in our ongoing series that we hit now and then of health careers. And so today we're talking about an area that everyone has heard the term but may not be as familiar with what they actually do, and that is medical records. And I'm looking forward to having this conversation. I am joined by two of our staff here at McKinley Health Center at the University of Illinois Urbana-Champaign. First up is Ginny Hicks, and she is the office administrator for medical records. Ginny, thanks for being here.
Thank you for having me.
And joining Ginny is another staff through medical records, and that is Andrew Howie, and he is an office support specialist. More specifically, he works with the release of information desk here at McKinley. So, Andrew, thanks for joining us as well.
Absolutely. Thanks for having me.
So, as I said, we're doing this series on healthcare roles. We've done various parts of the building because we have a lot of different roles in this building. When we go to other campuses, people are like, wow, you have a lot of staff, because we're a very robust health center, and I'm proud of that. But we have a lot of roles here, and students come in first time trying to figure out their own healthcare, and they don't really know much of anything most of the time, but they especially don't know all the nuances of what we do here. But they'll have heard the term medical records. They hear it because with immunization records or other things like that. And so I wanted to kind of take a chance to peek behind the curtain, so to speak, and hit this area that may not be as forward facing, or people may not understand as much. And so where I want to start off with is kind of explain what medical records is and what you do, and kind of the breadth of what you do. And because there's a lot of different aspects to medical records when you're talking about healthcare. So I'll let whichever one you want to join, but would you share a little bit about what a medical records department is and kind of what you do?
The medical records department is the department that actually does all the behind the scenes for the EHR, which is our electronic health record system. So we maintain that system. We help with that system. We train people to use that system. We also do the release, which is what Andrew is specializes in on that, which is any students that's wanting their records, or if anywhere else is wanting records for a student, we have them fill out a paper stating that they're okay with us to release that to other places as well. And then, of course, we have the scanning unit still in medical records, which also scans anything that we do not have as far as electronic-wise. We still scan in some paperwork that we get from outside sources.
So would you kind of explain very briefly? I know it's not easy to do because it's a lot of technical stuff when you start getting into it, and you don't want to dive into all that. But when you say electronic health record, I mean, that's really, for anybody who doesn't know, that's really like the neural network of a health clinic, because that's where all the information goes and comes, and that's how providers get the information on a patient. That's how patients get reports back and things like that. So what do you mean when you say electronic health record? What types of things are in that?
So the electronic health record is the patient's chart. So it has pretty much anything that the patient gets done. So if lab work is done, that lab work results would be in there, and the order for it to be done is in there. We have the notes from all the providers that are available in their electronic. So if they wanted to see what they talked about at their visit with their provider, they could get that clinic note and view it. Pretty much anything that can be done here, x-rays, they can be referred out to other places. Those referrals are all in there to show that they were sent somewhere else for specialty work that we don't handle specifically here at our clinic. And then, of course, if they need to go up to the health ed services or even mental health services, we do have those, and all that. Those notes are also available in their chart.
So it really connects every unit in the building, the communication amongst, and then also connects the patient to the provider in what they do there.
Correct.
Andrew, you have probably the most front-facing aspect of medical records because you are the release of information. What does release of information mean, and why is it so important?
Well, it's in our specific context, it's important, especially important for students to understand what it is, because there are different rules about how we release records since we're a state university and not a private hospital or what have you. We have to have the students' written permission to send their records anywhere, even if it's going to themselves. A lot of students aren't necessarily prepared for that and sort of expect it automatically because that's what they've done, at a hospital or whatever. So I sort of explain to them why we have to do this, why it is so different, and then I am sort of the main person who processes all the release forms, be that for a student who's here in person and who needs a copy of a physical exam for employment, or if it's a patient who has a serious ongoing issue and requires outside communication with, Carl or somewhere up in Chicago or wherever the other hospital is. I'm sending that stuff back and forth. We also request records from outside facilities. Say a student needs to get a prescription filled here. The providers, especially for a lot of controlled substance prescriptions, require documentation of previous, prescriptions and basically proof that is necessary for the patient. There's a lot to learn about it. I've been, I guess, doing the release as my main detail for going on 3 years, because I will get into this later, but I worked here for a while, left and came back. So basically, there's a lot of different functions for it. And the rules in Illinois are particularly stringent as far as how medical records are handled. So there's a lot of attention to detail. There's a lot of making sure that the right records are going to the right person, whether that's me sending something out or getting something in, getting it routed to the appropriate provider that a patient is seeing here. There's a lot to it. Sometimes it's as simple as printing an immunization record and faxing it. Or sending lab results to DIA or whatever. Sometimes it's putting together a whole, history of everything a student has ever had done going back to 2002, and mailing that to someone, some other clinic. So it can be quite involved. I've sent records to Australia, to the UK. I sent them to China once. Whether they actually ended up there, I don't know. That takes a long time. I know the Australia one got there because the kid contacted us and let us know. But yeah, it's fairly demanding isn't the right word, but it requires a lot of attention to detail and review. And for lots of different types of records, there are different processes you have to go through. So it's a lot to keep, straight in your noggin. And I'm grateful to have Ginny helping me out with that, because she is pretty crucial in some of the review processes as well.
Well, and that's one of the reasons I was looking forward to having this conversation. We've been talking about it for a while behind the scenes, of wanting to invite you both on, because you do, I'm in awe of what you do, because you all have knowledge of things and you just kind of like, oh yeah, we do this and we pull up this is a situation we do this. You have a lot of different. There's no one rule fits all, right? No one size fits all. Every single situation with every single student is unique in some way. Mm-hmm. And to navigate that when you're talking about medical records, which is heavily protected and rightfully so, and has a lot of legal stuff tagged to it, that's a daunting task.
And I want to touch on what you said there, because you're just mentioning just the student stuff, and those in and of themselves, like you said, there's no one size fits all. But that's just students, to say nothing of getting a subpoena from a law firm, right. Or a firm looking for records for a bus accident or something, So and then there's a whole different set of procedures for those.
Yeah. I laugh because I work in administration, and we'll get a fax or a request for it, and I'm always very happy to send it down to you and let you figure out what's going on. That I don't have to figure that out, because that's daunting. Mm-hmm. So you both do an amazing job. Your whole team does an amazing job, and so I wanted to highlight that a little bit. Another aspect of this that people don't always think about is that we are the health center for the university. So we are seeing, let's say, 50,000 kids every semester, right? Or every year. That's 50,000 that roll. But because medical records, you have to keep records back before. You're interacting with people who are no longer students, who haven't been students for maybe 5 or 6 or 10 years. So you're not just serving, that 50,000. You're serving 1 million, potentially, that you have to be aware of what's going on, and you have to be ready to answer questions on that. And that's mind-blowing.
Yeah, we have to hold records for 20 years. So for 20 years, we have to, immunization records, we have to have all of those on file and ready at any time that anybody wants those. Everything else is pretty much 10 years, but for immunizations, it's 20 years, and we do have a lot of people that want it even before then, and we have to tell them that those have been destroyed at this point and that we don't have access anymore. But
and if you to put that in perspective, there's potential that you are interacting with a student who needs records, and possibly their parents who need records, because they both fall in that window. You got a freshman coming in at 18, somebody who had a child, as early in their college career. You may have both of them asking records, and that's just that's another little aspect of it that people don't really think about.
Right.
One thing that's fairly common for older previous students, like you mentioned, is a lot of them need immunization records for immigration when they're trying to become a citizen. And most of the time we still have them because those are within like 10 years usually because they want to like, get a move on it. But occasionally we have had to tell people, it's just like Jenny said, it's just too far back and we don't have them anymore. So,
But I mean, that's rare that you guys can't help somebody.
Very rare,
and that's really just a testament to how well you guys do your jobs. So the next thing I want to ask is, because we talked about kind of what medical records is, but would you share kind of what your days look like? Because Jenny, your day is very different from Andrew's, but you have specific things that happen throughout your day, and there's certain routine that you have, but there's also the unexpected that comes. So would you just kind of give as best you can, a snapshot of what a typical day looks like for you working in medical records here at McKinley?
Do you want to start, or can I?
Sure.
Yeah.
Go ahead.
Okay.
Go
So
ahead.
mine is just the release forms are the first thing I check. Obviously, that's sort of the standard. There's usually a couple that have come in overnight. Right now it's kind of slow. Students aren't back yet, but on a typical day, there will be, maybe 6 to 10 usually in the morning. If it's like a typical day, it's usually something small, like they need the clinic note from yesterday for a show professor or whatever. But then there's the outside labs. There are students who are taking medicine prescribed by someone outside. They have to come in and get that. That's always the second thing I check in the morning. I don't always get to it because there's students come to the window and whatnot. But I'm during the semester, I'm fairly busy with paperwork, usually just sending records wherever they need to go, basically from the time I get in until the time I leave. If I'm all caught up, which rarely happens during the actual semester just because of the volume of work that comes in, I will sometimes help Reba out. She typically mans the referral stage, so she's facilitating all that. I will be her backup if she needs help with that. But by and large, mine is basically paperwork, just getting records either sent where they need to go or requesting them to come here from somewhere else. That being said, it's not uncommon to get students who are lost and rather than try to just tell them where something is, because I remember coming here to start work and not knowing where anything was, I'll just take them where they need to go, and I find they really appreciate that, especially if there's a bit of a language barrier. So it's like you said, there's some routine where it's just I just check which forms need to go. Jenny will bring me any invoices if we're sending anything out to a law firm or insurance company or whatever. So I basically know kind of what I'm going to be doing, just not exactly like where I'm sending anything. But I there's never really any guesswork for me when there's guesswork once I start with some of the paperwork.
Right.
But no guesswork as far as like what I'm actually going to be doing, which I find kind of reassuring, just knowing what needs to get done when I get in.
And he mans the phones a lot. We
Oh,
get a
yes.
lot of phone calls.
Yeah.
And we have to make a lot of phone calls. We have a lot of where we have to call students to verify exactly what they want on their form because it's not filled out the way it should be, and we have to make sure that we are sending what they're exactly wanting. Mm-hmm. Or having to call to Carl because something didn't go through that they said we should have or that they should have had that's not there, or even students calling in because somebody upstairs didn't know the answer, so they transferred them to medical records because we know all.
We do seem to be the hub for that.
Yeah, we know all. So they send everything to us, and we figure out an answer for them one way or another without having to transfer them again, preferably.
Yeah, ideally, yeah.
Yeah.
Mm-hmm.
And I've seen you both interact with students who don't know what they're doing or not sure. It's a new process, and you're both fantastic. I mean, you do a really good job of helping the student, reassuring them while teaching at the same time. And it's very plain to see that when students come to medical records for information, they leave better than they came. And I think that's a huge bonus for McKinley, for our campus, for our students, because again, these are students who are trying to navigate for the first time. They're trying to figure it out for the first time, and there's a lot you don't know, and it can be really daunting. And I think you guys do a fantastic job of helping reassure fresh adults.
Well, and a lot of them are international students and are unfamiliar with our healthcare system, and a lot of them are very confused by that, and they require a little bit more explanation. And I just think to myself, like, look, they're here, they're already probably not having the best day, just because they're navigating paperwork and all the tedium that goes along with getting established somewhere. So I just think to myself, why would I make their day any worse?
Well, and and you say that with they don't understand the American health system. I'm 46 years old. I've been in the American whole system all the time, and I still don't understand all of this.
Exactly.
You know, when I do my kids'
Yep.
stuff, I'm like, okay, what are we doing here, and who do I need to talk to? It's not the easiest to navigate when you're in it, so that's huge.
I hear Reba arguing with insurance companies for authorizations for referral stuff that they don't want to pay for, and it's like, but they paid you the money, so do it.
So there's definitely a mediary and a teaching aspect to this job, which I appreciate that you both do. So Jenny, your day, what does your day tend to look like?
So my normal days are I do a lot of reports, weekly reports and annually, daily reports that I send off to upper people that need to get their people on board and getting things done as far as like closing notes, finishing notes, stuff like that. Flu counts, I do all the reports for all the flu counts because, we're all big on the flu and making sure everybody is covered with their flu shots. So I run all those reports in the morning. That's usually the first thing that comes up. And then after that, I do a lot of review because anything that is mental health or legal that is leaving, as far as release-wise, I have to review. It can't just go out the door. It has to be second reviewed before it goes and make sure that everything is filled out properly and all the signatures are done and everything's done as it's needed. And then from there, basically a lot of unlocking charts, deleting notes that were accidentally started because they started too. Or just answering questions from staff. I get a lot of phone calls from staff that they're not sure or something's happened with theirs that they can't figure out. So they'll call me to come try to figure out what's wrong with the EHR system to help them figure it out. So that's my main days right now, or previous. Right now, I do a lot of meetings for Medi-Cal 1 since we're going into the new EHR system. So a lot of meetings right now. And that takes up a lot of my days. And
part of that is because you're the supervisor for the unit. Like
Correct.
You oversee medical records. And so that's why you have a lot of the reports and the meetings and the things like that. So that's kind of the aspect where Andrew, you're more front facing, Jenny, you're more overseeing, and that kind of shows the dynamic between the two and the difference between the two. Which leads me into my next question though. And Andrew kind of mentioned it earlier, in that you both have been here for a while. And you've had a couple different positions here. So if somebody's listening to this and they're like, you know what, I like data, I like, medical, like records, and I like information, and this just seems kind of interesting, but how do I get into this? Would you share a little bit about how you started here at McKinley, kind of how you got into it, and then kind of your path of how you got to where you are now? And like, what did you have to do? Was particular schooling you had to do or training or anything like that? Or was it kind of on the job learning as you went?
So for me, I've been here for 17 years, so I have been here quite a while. I started in the medical records department as actually extra help, to be quite honest, and I did 2 stints of extra help before I was actually hired full time. And then I've just worked my way up the ladder from there. I started out just as a simple, back then it was just a assistant clerical even. It wasn't even OSAs as it is now. It was just an assistant clerical. So I was way low on the totem pole. I worked the night shift even because back then we had paper charts. We didn't even have the electronic. So I've just worked my way up. I did leave McKinley for about 3 months and went to the registrar's office and sat over there and was bored as all get out and begged to come back. And so they did bring me back, and I went to the MIS department from there. At the MIS department, that was all basically data entry of immunization, so it's still basically doing medical record stuff. And then, of course, MIS office also did all the scheduling for the doctors and stuff. So that office was very busy all the time as well. And then they decided down the line to revamp everything, and they put MIS down in with the medical records. So MIS became part of medical records at that point.
And then you've been in the administrator role for...
I've been in the administrator role since about February of last year. So, and then I took on extra in May when the medical records administrator herself left. She was medical records technician, I think is what she had title-wise. Anyway, when she retired, I took on a lot more of her roles also. So,
and Andrew, what about your path here?
I also started as extra help. I was fresh out of college, and at the time I was working 2 jobs, 7 days a week, just to keep a roof over my head. And I had been applying for extra help. I got hired here, and then towards the end of like my 900 hours or whatever, someone I started with a K. She used to work in medical records when we had a transcription department. Someone in her family got very ill, and she had to quit to take care of them. And somehow it came up that I had a typing score of like 90 words a minute or something, and they're like, "We need a transcriptionist like now." So that's how I got. That's what I got hired to do full time at first. In Extra Help, I was sort of what did they call me? A floating utility, I believe was the term. So I've actually kind of done like everything in medical records, because I've done the scanning. I helped when I first got hired as Extra Help. It was because, if I recall correctly, the department was behind on transferring paper records into electronic records, and so I think the move from Start EHR to Medicat had just happened, because I got hired as Extra Help in like October 2014, I think. So I did just kind of whatever they told me to until I got hired for transcription. I did that full time for about 5 years, and then in February of 2020, I got the bright idea, well, I've been here for 5 years, I should try for a promotion. And so I went over to Freer Hall to work at KCH, and that was when I went from OSA to OSS. Well, February 2020, as everyone knows, nothing bad happened after that, and everything went fine. And so, everything got flipped upside down, and so I helped that department limp through the first year and a half of COVID as best as I could, but due to the hiring freeze, the whole staff that was supposed to be hired around me never materialized, and I ended up with, through no great malice of anyone's like ill intent or anything, I just had too much on my plate. And I remember emailing Tasha, the old admin that Jenny referenced, and saying, hey, so hypothetically, if I wanted to come back, like, anything happening. And at the time, I think someone was getting ready to retire, and I think I had an interview the next day, and within 2 weeks I was back here. And so I was very, very grateful for that, because it's not that the work here was any less difficult or required any less attention to detail than my other job, but it was all within the same scope. It was all medical information. It wasn't textbooks and which classroom is going in which room and which professor needs this lab reserved and which grad student needs 6,000 copies of this, and so I've been back since like June of 2021, I think. And then I took on, when I came back here, I actually took a demotion just to, get somewhere where my work-life balance was a little more manageable. And so I went back down to an OSA, and then we had a little bit of a reshuffling in both responsibilities and which employees were in which department. And so to get me trained as a backup for the referral clerk, I was moved up to an OSS, I believe is how that procedure kind of worked out.
Yes, because we added referrals to the medical records at that time also, because referrals used to be done by nurses, and then they decided that they were going to add referrals to the medical records department. So,
and so I've been helping out with that since December 2022-ish? Yeah. There were some bumps in the road and some growing pains with the training, but I think myself and my direct coworker now, Reba, I think have a pretty good working relationship, and we can pretty much handle most things that come our way. But when we need help, Jenny's there to put the fire out.
Well, and you've inadvertently highlighted something that I think is really important, in that coming into this, neither one of you talked about exactly what training you had prior. Like, you need a degree in this, or you need to take classes in this, because you both talked about learning kind of on the fly. And part of that is because, and we all know this, but I think it's even more so evident in medical records, that technology is advancing and changing so fast that the stuff that you both came in, the things that you knew in the first 2 years that you worked here are completely obsolete on things that you do now.
Yes,
completely. What I mean? So it wouldn't even have mattered if you'd had certain training, because you learn as you go. Because we talk about EHRs and how they change, and the process there, and going from paper to electronic, and referrals, how they change, and just how everything functions in medical records is so technology tied to technology, that as the world advances, your jobs advance too, and your entire unit do a fantastic job of keeping up with changes and things that you learn. And it's like, okay, we're doing this way now, and we don't miss a beat here. And that's just a huge testament to both of you and everyone you work with in medical records. So I appreciate you sharing that journey, because it is, often, especially if you're listening and you're in college education, in your secondary education, we often have this idea that my path is going to be linear. I'm going to go to college, I'm going to get my degree, and it's going to be a straight shot to wherever I go. And most everyone I talk to of any episode, we talk about their path to where they've gotten, and hardly any are linear. Everybody looks like the most jagged, winding road ever. And it's not that it's a bad thing. It's just like, I was here, and then I ended up over here, then this happened, and I went up over here, and then this is where I am. And so I think there's some value in recognizing that and understanding that is part of the process.
Touching on that, I used to go to a counselor fairly regularly for a long time, on and off, and he said that while it was more common for like people like my parents' generation, like late 60s, early 70s, they'd have their one career, they'd be done, they retire, they work there for 40 years, that's it. He said that it's much more common for younger age cohorts to have 5 to 8 like careers throughout the course of their life. I've been here long enough that I consider this like a career. I've been at the university for 10 years. Like McKinley itself, probably 8.5, I guess, if you cut that middle year and a half out. But 10 years, most people don't hold one job. Most people my age don't hold the same job for 10 years. And again, not that there's anything wrong with that. Like you said, it's just way more common. I don't think that there's like a lot of incentive to be super loyal all the time like there is for a place like this. You know what I mean? Like when I came back here, it was this weight had come off my shoulders. And again, I'm not talking trash about KCH. It was just the circumstances of COVID. But coming back here to like people I knew, like dynamics I understood, and just a supportive work environment. And it's kind of like what you said earlier, how we have a procedure for everything. Like someone has a question for us, 99% of the time we have an answer. Ginny's put together this insane drive that Reba and I both share, and there's procedures, there's forms, there's stuff we don't even use anymore, but in case we have to reference it, it's there.
And the other part of that is, like you said, there's 99% of the time there's a procedure. I also know that in working with you, if you don't have the answer, that 1%, you'll figure it out. Like we're going to talk, we're going to find out what it is. It's not going to be like, we don't know, tough. See ya. And so I think that's an element of it too that's very comforting for all of us who work here with the department, interacting with it.
We have often heard from people on the phone, and this isn't just to toot my own horn, but Ginny has heard this before, I know Reba has heard this before, and I myself have heard it, that they are often, when they are done talking with us, they finally feel like they understand what they need to do with whatever the situation is, and that they have finally gotten the help that they were looking for. So
it's very helpful, they always say. You guys have been so helpful to us.
We try to be.
So the last thing I want to talk about is, and this is part of this series that we're doing as well, is to try and give an opportunity to kind of share we talked a lot about what you do here, your role here, your function here. But this is not the defining all in all of what you are, who you are, anybody who works here. We all have lives outside of this building, but when students come in, they only see us in this aspect, and that's not a knock on the students either. No. When I go to Walmart, I know my greeter over there, but I don't know him outside of the greeter. So in my mind, he just lives at the doorway, I guess. Yeah, exactly. He doesn't do anything outside of standing at the doorway and greet me. He's a great guy. I love him.
I live down in medical records, so
So I want to give an opportunity to just share a little bit for listeners to get to know who you are outside of your job. You don't have to share much, or you can share as much as you want to, I guess. But like what's a hobby you do, or what's something that you love to do, or an aspect of yourself that's outside of this job that you would want to share about just a little bit.
You got anything? Okay.
Go ahead.
Well, I really like music. That's my big main thing outside, in my personal life. I play instruments. I have over the years written several different music columns online. One used to be published in the News Gazette. That changed when the new ownership took over. They didn't see a need to keep it around, and I agreed. I write every now and then for one on the East Coast. That one is not defunct exactly, but I got some burnout from doing it just a little bit too much. But I will. That one was mainly for artist interviews, and it's usually, I'm not Rolling Stone, so it's not like I get, the most famous people, but I interviewed, the bassist from King Crimson, a very famous prog band from the 60s and 70s. I interviewed a guy named Melvin Seals, who played keyboards with Jerry Garcia's solo band. Carl Denson, he is the current saxophone player for the Rolling Stones, and he has his own solo project, Carl Denson's Tiny Universe. I actually just restarted a blog with my brother and a couple of our other friends, one who lives in Seattle and one who lives in Buffalo, and it's just album reviews, links to where you can buy the record. And then I play several instruments. Saxophone is my main one. I've been playing that since the 4th grade. I don't play it as regularly as I should. That's one of my biggest regrets from college, was not finding some group to stay active with. I play guitar and bass. I wouldn't say I play keyboards, but I dabble enough in it. My brother is the piano, genius in the family. And then I used to sing in a band that I recently put on hold just because I don't like traveling to and from Chicago for $25, you know. But that's my big thing. I like music. I like reading. Video games occasionally. I'm not huge into them. My wife is, though. She bought a PS5 for Christmas and has really been enjoying that. And I like to travel. I can't always really afford to do it, but I've been to 35 states so far, and we just went to Scotland and Ireland in the fall, and that was really fun. That was a really once-in-a-lifetime thing. We went for my dad's 70th birthday, so that was fun. And if I don't stop now, I'll probably just ramble forever. But I really like listening to music. I like going new places. I like to say I like cooking, but then I start cooking and I go, oh, I don't like this. Right. You know, so I like to eat the food when it's done, and I will help out with the cooking, but I'm not the chef in the family. So yeah, that's it. Music, travel, cooking. My animals. I don't know how I forgot about that. That's a huge thing. I've always loved animals ever since I was a kid. I currently have 2 dogs, a cat, a Russian tortoise. I have a small little fish tank, a little 20-gallon, and then I have. Are you familiar with an axolotl?
Yes.
Yeah, I got one last summer. He was the healthiest one I've ever seen in a pet store. He had all of his toes and all of his legs. Well, because they can regenerate them, so people say, oh, well, let's just put tons of them in a tank. Well, they still eat each other, right. And so mine is great. His name is Bowser, and he's I got him and he was about 2 or 3 inches long, and he's now 6-7 inches long. So yeah, I've always liked animals quite a bit. When I was a kid, I thought I was going to be like a zoologist or a marine biologist, but that didn't exactly pan out. The science was a little bit lacking in college for me. But yeah, so I again, music and animals are the 2 biggest things. And then I really like reading, video games again, occasionally. Kind of traveling. My wife and I have a fund right now. We're trying to go to Tokyo in 5 years. So we'll see how that all goes, But yeah, that's me in a nutshell.
Jenny, what about you?
I've got kind of a boring life, to be quite honest. I always have 2 to 3 jobs, so if I'm not working here, I'm usually working somewhere else. Right now, I only have 1 other job, but I am in the process of getting that third job, I guess you can call it, because this is my first. I tell everybody this is my first and primary job. So, but I do have 2 other jobs. 1 other job and 1 that I'm working on getting that I should be starting within the next probably month. So I do a lot of working, but I am a single mom of 2 kids, so they are finally both grown and out. I've got a 24-year-old and a 19-year-old, so pretty much lived life through them, for them, with their sports, especially my daughter. She was in every sport you can imagine. So we did a lot of that as she was growing up. And now that she's out of all that, I don't really have much more to do, so I really just work and then hang out with friends. I mean, that's boring life.
No, it's that transition, because I say that because your daughter and my daughter played at the same time, and we would cross paths in sporting events. And when mine went to college and hung up the sports stuff too, I also looked at my wife and was like, okay, what do we do now? We got 2 younger boys, but they don't play sports and they're not at that stage yet, and so we're not going to tournaments every weekend. What do we do? So no, it's not a boring life. It's just a transition period. So you're figuring it out. But no, I appreciate you both sharing that, because again, it's giving a window into who we are outside of our jobs here. We all take our jobs seriously. We work hard at what we do, and when we're here, we're focused on it. But it's there's other things that we like to focus on in our other time as well. But I just want to say thank you for having you both here today and sharing about medical records. Again, it's an area that people have heard of or familiar with in passing, but they really don't have an understanding of what it is, and I think you both painted a pretty good picture here today. So I just want to say thank you for coming in and talking with me.
Thank you for having us.
Yeah, thank you. It was fun.
If you're listening and you have any questions about medical records, whether you need to interact with them or you're curious about getting a job in it, feel free to stop by and ask us. Somebody would love to chat with you, or you can send us a message to Healthy Illini, send us a message here at McKinley, and we'd be happy to have that conversation with you, because as we said before, it's not a linear path. You never know what's going to come up, and there's oftentimes you get an opportunity to learn about something that you hadn't had knowledge of before, and it kind of changes your path or your interests, and it sparks something. So feel free to have that conversation. We'd love to hear from you, especially as this semester is beginning ready to kick off here in 2025. But thank you for joining us today. You're on a personal journey no matter where you are in it. You are important and you matter. Your health and wellness are important and matter, and we're here to keep you well to excel. So go have a great week, Illini. Let us know how you're doing, and we'll catch you next time on Healthy Illini.
2